Well, this course was actually recommended to me by three other physicians that I work with, and they had a great experience and they passed their boards in the first attempt without much difficulty.
Actually, I've heard a lot of great word of mouth. I actually signed up for another course in San Francisco, and one of my colleagues at work took Dr. Ho about 10 years ago and said it was the best course he'd ever taken and the only thing that he took to pass, so I changed it. And both me and my husband are here, and it's been an excellent course.
I talked to several of my colleagues and friends from residency. They took the course and were very pleased with the instruction and their outcome.
Well, I took this course because I had taken another actually, and I found after we were at the end of the course today actually, and I found that this course was vastly superior. I mean, the level of content, the pace at which we handled that content, the competence of the instructor. I mean, it was like night and day. I don't think there's any other course that I would recommend to anyone of my colleagues if they were preparing for the oral board exam, other than this one. I mean, he working with you, he accomplishes more than you could have accomplished by yourself. In just 6 days, it's almost like 6 months of preparation. Literally, it's fantastic.
I heard great things about Dr. Ho's course. A lot of my colleagues in residency had taken his course and had done very well.
Well, I'd heard a lot of good things about this course from people in my program and people that I knew around the world of anesthesia, and everyone had great things to say about the course of it helping them pass their exams.
This course actually came highly recommended by another physician I work with, and it's been a fantastic course.
Well, I trusted the content, and I was also looking for something conveniently located for me, and I heard good things about the course.
Yeah, it's been a great experience. Dr. Ho definitely prepares you for how to dissect questioning throughout the oral boards, and looks like I will hopefully do really well. I feel like I'll be prepared.
Absolutely. It's grueling, long days, but he packs everything in. He teaches you everything you need to know, and he gears it so that you know exactly how to speak and how to present your cases.
The course has been great. I've been very, very happy with the instruction and the review. I think it's been very comprehensive and very helpful.
I'm very glad that I took this course. I feel like that it's, I'm taking this class, far in advance of my preparation, and I feel like it's jump-started my studying. I'm tremendously satisfied with the product, and I would definitely recommend it to my peers.
I'm very glad I took the course, yes. Why? Well, the course is very helpful because I realized that the oral boards are not just about what you know, but having the ability to present the information in an articulate way and to be able to convey that you are really a perioperative consultant. And so I think the course really focuses the physician on helping them to communicate that.
I'm very glad I took the course. There's a lot of information, and it's hard to even know where to start with learning the information. And so Dr. Ho kind of gives a guide of how to study for the exam, not only the information for the exam, but with mock oral exams and everything involved. It's just a very comprehensive course.
I'm actually very glad I took the course. I realized that I didn't have a lot of time to study for the course. I needed a course that would give me a lot of information, hopefully in a short amount of time, and this course has fit the bill quite well. All the information I've gotten from it is quite in-depth and very extensive.
Absolutely, it was very helpful, and the information provided has really improved my basic knowledge.
This course teaches you how to dissect the questions in order to think a couple steps ahead of what they're looking for your answers.
They're about 10-hour days. I'm taking this 6-day course right now. So he's packed in cases where there's full of information, and most importantly though, what the oral board examiners are looking for, how to present yourself, how to speak, and deliver your information most effectively.
I think mainly the format of the questions, how to respond, how to formulate your answers, how to organize your thought process, which I've found myself over the course of the last few weeks with the CAM clubs and some of the other review, changing the way I approach some of my patients even now, based on the things that I've learned in the course.
I learned about the pace of the exam, about how to respond, about what is unnecessary, how to make my responses to their questions more efficient, and just about how much you really need to know for the exam and what you can dispense with.
Definitely learned that knowledge is key. That's first and foremost the most important, and then being able to give the pertinent, I guess I should say pertinent positives when it comes to our cases and giving what the relevant information is that they're looking for.
Dr. Ho knows a lot about the oral boards. He has a lot of friends that give the oral boards, or he's talked to people that know a thing or two about them. I learned what they are and what they're not. They're not trying to trick you, but they do test your knowledge and the way that you can convey what you're trying to say. So what they are and what they're not is probably the biggest thing of what I learned about the oral boards.
I feel like I learned about the mechanics of the oral board from this course. It went through the ins and outs of what to expect and just how to prepare for it, not just knowledge-wise, but just how to prepare for it the day of and what I need to do, what I need to think about.
To take seriously, it's a serious business, and you need to be well prepared before taking it.
It actually felt like that it exceeded my expectations. I feel like I'll be more prepared to take the exam.
It's exceeded my expectations, absolutely.
Yes, I think it's been as advertised.
Oh, it exceeded my expectations. I thought that it would be just simply lectures, but the fact that there were examinations in this was fantastic, and the examiners were very good. They kind of break you in. They tell you what you can expect, and it's I think the simulation of the actual exam is really good.
It did, absolutely, yeah. I'm really glad I did the 6-day course. I know that they have a 4-day course and some other courses, but I think the 6-day was really the best way to go.
The course definitely met my expectations. It's not an easy course. It's very difficult, but all the information, he gives you just about every piece of information you need. Sometimes it seems like some of the details are a little too much, but it's an incredible amount of information, as well as practicing, lots of practicing for the oral boards with mock orals, talking with the other students in the class. So it really was a great experience.
I have to say the course definitely did meet my expectations. In fact, it exceeded my expectations. I really like the way Dr. Ho was able to go into the material in depth, and he brings a different way of thinking about the material that makes it easier to understand.
Absolutely. It was well prepared, well paced. There's a lot of interactions and a possibility to answer questions.
He was a fantastic teacher. Went into extreme detail when need be, and covered all the topics that are high yield for the exam.
Dr. Ho is an amazing teacher. He has an extreme breadth of knowledge. He makes everything very easy to understand, and he's able to pack in a lot of information. So it's almost going through an anesthesia residency all over again in 6 days.
He's a great teacher, very entertaining. I think what I appreciated more than anything was the way he correlates all of the topics to cases, either cases that we're working on or stories from the operating room. I thought it was very, very effective to help kind of solidify the points.
It was fantastic, actually. He's very well spoken. He makes the class interesting by interjecting personal stories from his past experiences and humorous anecdotes. It keeps the class lively. It keeps the class because there's quite a bit of lecture, but it doesn't seem like that because it's enjoyable to listen to.
Yes, he's a very good teacher. Yes, and he's also very entertaining. He keeps you interested the whole day. The days are long but very informative, and so he's very good. Yeah.
Dr. Ho is an excellent teacher. Not only is he a teacher, he's an entertainer. So he has excellent stories and anecdotes about things that have actually happened to him and colleagues, mostly him. Just about every fifth or sixth sentence is a story to help you remember some little detail or some big detail of anesthesia and perioperative care. So it really was good information, but also very entertaining.
Yeah, he's a very good teacher. He definitely does have a good grasp of this information, and he relays it to you very well. And and also he's not just a boring lecturer. I like the way he keeps us interested and keeps us laughing throughout the whole course. He's a lot funnier than you would expect.
I would say he's a wonderful, great teacher, and since I know him for a few years, I know how much effort he plays into the preparation of the course and how much significant updates he continuously provided.
Well, the anesthesiologist is the critical care specialist and has to be able to take care of the patient in all three phases.
We're expected to manage a patient, take care of the patient based on what we know about their comorbidities, but also to follow them up and make sure that they stay comfortable.
I think we're the clinician that is over everything. We have ultimate responsibility for our patients from when they arrive to when they go home, not directly, but based on our care.
I feel like it's more than just putting the patient to sleep. Obviously, you have to consider the big picture, and so in perioperative medicine, you have to consider all the patient's comorbidities, all of the patient's various factors, their body habitus, their psychosocial concerns, and so I think that that to a certain extent we should be involved in the entire arena, and I think preoperatively is especially important.
Our role is to care for our patients, and to do that and it is a perioperative, so it does start in pre-op, intraoperatively and post-op, and it requires a good strong knowledge base of comorbidities and the physiology of our patients.
So our role is to assure that patients are appropriately healthy and safe to go to surgery, as well as keeping them safe in the pre-op, intra-op, and post-op time.
Well, in generally, our role is to make sure that that the patient is ready for their surgical procedure, is able to undergo the surgical procedure, and afterwards we make sure that there aren't any major complications arising from the procedure.
We are the expert for the perioperative medicine, so we have responsibility before, during, and after surgery in all aspects of medicine.
It definitely has. I will now take a look at every situation a little differently. Dr. Ho's made my thinking on how I actually practice medicine now a little different, how I approach every situation.
Well, absolutely. I mean, I think it's taught me that our roles can extend beyond just the operating room, and it's definitely made me think more about things to be aware of and to make the patient more safe and comfortable.
Yes, as I mentioned previously, it has changed the way I approach my patients.
Yeah, I believe that now more than ever, after having taken this course, I'm much more things are on my radar. I'm much more equipped to anticipate potential problems, and now not just intraoperatively but postoperatively. Instead of just responding to a crisis, I can anticipate it.
I don't think it's necessarily changed the way I view myself as a perioperative physician, or my role. But I do think that it was a great. Not only is it a great way to practice for the oral boards, it was a great knowledge review. It definitely makes me feel stronger as a physician. It makes me feel like that I'm making the right medical choices. And a lot of what's most important is that Dr. Ho's course and his presentations are backed up by the most recent literature reviews and studies. And so I feel like I not only got to review, but I also feel like I'm leaving as a better physician.
I'm not sure if it's completely changed the way I think about my role as a perioperative physician, but it does help with my role. I feel more confident in certain disorders with patients. I'm not going to have to open up my smartphone as much and take a look at certain disorders. So he does give an excellent picture of the appropriate way to care for your patients in a perioperative setting.
I would say that the course has elucidated a lot more about our role. It's given me a lot more information to handle a lot of these different situations, pre-op, intra, and post-op that maybe I didn't have before. So it's been a big benefit to me.
I would say has confirmed my role. So I'm very proud that we're taking seriously our profession, and we're not just practitioners. We're physicians.
The camp club was excellent. It was useful. I work full time, so it's always after work. Very comfortable. You go over very high yield cases, so it's an excellent supplementation.
I thought they were great. A lot of the material was repeated here, but it was great to those things that I saw previously in a different case setting with a different scenario. I thought that was helpful.
This is a great course, and I recommend it.
Nothing but great things to say about the course. Again, it's excellent. It's a boot camp, and before this course, I was just reading, highlighting for the way I would study for written boards, but after this course, it's definitely geared me for oral board examining. Absolutely recommend it.
I think this class is fantastic. I think that there is absolutely no other class that I would recommend. This is probably the best on the market.
I definitely recommend taking this course. Like I said, I didn't even really know exactly where to start studying for the course. I was very nervous. Dr. Ho and his board examiners are excellent at testing your knowledge and giving you feedback. And so it's helped me feel a lot more confident as I go into the final stretch right before my board exam.
I would say that this has been a great experience.
I think that's it. I really did enjoy this course. It's been very helpful. I think it's going to make me a better anesthesiologist in the long run.